Good afternoon, everyone. It is a pleasure for me to join you today for this opening of this international webinar. And my presentation is on the impact of COVID-19 on older persons. We have heard this morning from the very insightful speeches that COVID-19 had impacted on a global level older persons. Older persons are the most vulnerable group in society, and as a result of this pandemic, WHO it ordered, and advised all older persons, all the governments, to mandate this on older persons to self-isolate as a very important measure so that they will not be contaminated with the virus. So on one hand, this measure was and is still a very important positive aspect within the context of COVID-19 and older people. But on the other hand, we have also to really know the impact of the social isolation on older people. What does this mean? Social isolation is bringing a lot of negative repercussions also on this group of people, because of this social isolation, older people are having few social relationships. We have to remember that social isolation, it was already present, within this cohort of older people. Older people were already passing through social isolation prior to COVID-19, but now we're seeing its impact being more magnified because older people are having few social relationships, and this is as a result of their infrequent social contact with others. What is the result about this? We're seeing older persons living in continuous fears, first of all, about their own health, because they might be hearing different types of news as well, and bits and pieces of what is going on out there. As a result, they are anxious. There is this fear, of course, fearing they are not going to be able to meet their basic needs, because if, for example, before they used to go out to buy the necessary food and their basics, and now they're asked to stay at home, and no one is there with them to help them, as you have, it has been said this morning as well. The persons are being left behind, even by their own families, because the family now are living in the cities, are living somewhere else, because of work, because of education. And it could be that now, because they are self-isolating, the older persons who are being left living in their own homes in the community are fearing that they are not being able to meet their basic needs and grocery shoppings, even in doing their activities of daily living, like getting up in the morning or having a shower, or even to put on the clothes. It varies. And of course, they are affected by deeper degrees of social isolation, especially those who are living in rural areas where perhaps they don't have not even a television or radios even, let alone having mobiles and other technology. We also, I also would like to focus on the impact of COVID-19 on persons living with dementia. Of course, dementia should never be associated with older persons, but we we also should address this because we know that the number of older people, age 60 and 60 plus, and the number of people which are going to be affected and diagnosed with dementia is on the increase as well. Many who are living with dementia are older persons, so they are more at risk to get the virus. So, of course, the measure for this group of people is stronger because they are the ones who society, authorities, the government is telling, please don't go out, stay at home. People living with dementia may find it more difficult to adopt or comply with various protective measures, especially if someone is during the mid stage and advanced stage. It's very difficult to explain to such people to keep social distancing, not to go out, or to wear a mask, or to wash their hands. We all know that for persons living with dementia, the routine is very important, and now all of a sudden, because of these COVID measures, the routine is destroyed. Because whereby before we used to encourage older people living with dementia to go out, to still, do the things that they like to do, their normal things that they like to do, and used to emphasize about the importance of still being within the community. Now, because of these COVID measures, we're telling them quite the opposite, stay at home, don't mingle, don't go out in the community, just to be safeguarded and not to be impacted with this virus. But what is happening? Disturbance of this interaction of their routine is having a heavy toll on their cognitive stimulation. They are deteriorating faster because by being left alone, by not interacting with the rest of the community, there is lack of cognitive stimulation. There is also this fear of being abandoned. If someone can't really make heads and tails of what is going on, they feel that they're being abandoned and their order of the day is disrupted. So yes, social isolation is a major risk for older persons. They are feeling lonely. It is affecting even their physical health, because many of them are not even keeping their appointments with their doctor at the clinics or in the hospital, either because the very appointments are being cancelled because front health workers and other professionals are focusing on the COVID-19 situation, and they are cancelling operations, cancelling appointments, etc. Or the older persons themselves are fearing to go for their appointments in case, they might contact the virus. And this is having a toll on their mental and cognitive well-being. Yes, the decreased support network that they had, even, in smaller amounts, now had disintegrated whatsoever. And yes, we're seeing a high level of mortality. The mortality that the whole world is seeing is not only because of COVID-19. Yes, we have seen, unfortunately, many older people dying because of COVID-19, but people are also dying not because of COVID-19. People are dying because of their other physical conditions that they are not taking care. The other physical conditions are not being taken care of because they are scared to do something about it. When we speak about older persons, we cannot leave out the informal carers. The informal carers is the family, or that someone being a volunteer, even a friend, a neighbor, who is taking care of an older person in the community. These informal carers, COVID-19 also impacted the informal carers. Why? Because the informal carers also are being self-isolated, either because they are staying with the older persons, or else they are still staying in their own homes, but they have broken all the contacts with the community, so that they will be careful not to take the virus themselves, because at the back of their mind they know that they need to remain healthy just for the sake of their loved ones, which are the older persons. So yes, there is loss of support and services. So they end up with additional care responsibilities. And we also need to remember that most of these informal carers, most of the time, are older persons themselves. So they also have physical challenges, mental challenges, health issues. And like their loved ones, they might not are not keeping appointments at the hospitals or at the clinic, either because they decide to cancel, or else because their appointment has been cancelled. What do I mean by loss of services? By loss of services, meaning certain community services, if these exist within the community. Certain governments, certain authorities, or even NGOs and voluntary organizations might offer certain services like Meals on Wheels, daycare centers, or even counseling, etc., for older people who are still living in the community. Many of these NGOs and even the government have just cancelled these services for the time being because of COVID. So here we're seeing that the carers, the family, is being left on their own. Most of the caring is being done from a distance, whereby the carers are living in their own home, the older persons are living on their own, and this is a toll also on the carers, because they only rely either on the telephone, if the older person has a telephone, or else they need to rely on the next door neighbors of their older persons. So yes, carers have the COVID-19 have impacted the carers as well. Also, financial issues may result in some carers. Some carers have decided themselves not to go to work just to protect their older persons. But not to go to work, meaning that at the end of the month, they're not receiving any salary. So yes, all this may create tension, anxiety, and burnout on the carers themselves, and indirectly, the COVID-19 impact on the carers is also an added impact on older persons, because this tension, anxiety, and burnout, unfortunately, will end up of the older person being abused, because if the carer is tense, they're going to maybe shout, at their loved ones. If the carer realizes that, they don't have enough money because they've decided not to go to work anymore to protect themselves, they might, burst, their anger, their frustration, their fears, their anxiety on older persons themselves. So yes, we need also to focus on abuse, which most of the times is hidden, this abuse. Abuse was always there, but unfortunately, because of COVID-19, yes, abuse is on the increase as well. During this pandemic, ageism has never been so evident, unfortunately. A lot has been done to try and eradicate ageism from society. What is ageism? It is stereotyping, prejudice, or discrimination towards people just because of their age. But as we have seen throughout the whole wide world, ageism is on the increase. It has never been so evident, and will no, even in public discourses, in governments' discourses, authorities, when you switch on the television or reading the newspapers, we are increasingly portraying those over even 60 as helpless, frail, unable to contribute to society. And even so, social media is projecting older persons as a group, as if they are all the same. But we need to understand that older persons are all unique. Older persons are a heterogeneous group, whereby you cannot just put this group in one net and treat them as they're all helpless and frail, unable to contribute to society. Most of older persons are still very independent. They themselves are doing voluntary work, and even voluntary work, example, taking care of their grandchildren or taking care of a neighbor who is bedridden. So yes, we need to see also and consider the resilience of older persons. So back to our social isolation, it is very important that while, yes, we need to implement the physical distance to protect the most vulnerable, we need to strengthen our social support. Older persons cannot be forgotten, older persons cannot be abandoned. So, yes, there are ways to implement that physical distance, but we need to strengthen the social support. And here I have prepared some recommendations. It is very important that the public health discourse there should be a paradigm shift even, in the public health discourse. So the discourse should be out there not emphasizing the social distance, but rather emphasizing the physical distance, but maintaining the social connections for both those older persons who are living in the community, but also those who are living in long-term care in nursing homes. It's important to mobilize resources from family members and community-based networks. We should know, who are the volunteers. There is no need to reinvent the wheel, because in every community, in every village, you'll find the chief, of the village, or the volunteers, or sorry, or the local councils, or the community NGOs, and authorities should make use of these small groups, of these volunteers, so that the people within the community will take care of the older persons who are living within the same community. It's also important that the public health discourse use easy to understand information. And not only information black and white, but even as important is the infographics and pictures. We need to understand that not all the carers, not all older persons know how to read and write. So pictures, infographs are important. And also important is the easy to understand information, not fulfilling the media and giving information just full of medical jargon. Also important is not to be culturally biased, and the information and the infographics should be culturally adapted for each and every community. And the information which corresponds to the needs of older people, lower levels of education, literacy, and language skills. So like that, we'll make sure that no one is being left behind, and that all the older persons coming from the different levels, different cultures together with the carers, formal carers and informal carers, are understanding of what is going on and what needs to be done. It's also important for all healthcare systems to respond to this social isolation. It's important that we'll see specialized teams so that if they know that older persons are not attending to their appointments at clinics and in hospitals, they'll make sure that they attend to themselves by creating mobile units, for example. Also, it's important that all the health and social care staff are tested, and now that the vaccine is in place, we have to make sure that all the health and social care staff are vaccinated. And also, speaking of this vaccine, that all older people should be vaccinated as well. And also, very, very important is to minimize bureaucracy and unnecessary barriers which might prevent health and social care professionals from providing essential services to vulnerable groups. And even equally important is to minimize bureaucracy and unnecessary barriers for older persons and their carers, and also for professional health staff to get vaccinated. The vaccine, this is the group which should be in priority. The healthcare workers or professionals and older persons. The role of technology. Yes, I understand. Not all people, not all older people, not all carers have this availability of technology, or rather they are not technological literate as well. But who can make use of this technology? And for those who are technology literate, yes, it's important that we make use of this technology, even simple technology like calling, our loved ones over a telephone. We're keeping physically distance, but socially we're there, by speaking to our loved ones. Those who have mobiles or laptops or computers, nowadays they can Skype, and keeping in touch by emails and other things. And also today we're seeing the development of more telehealth approaches. Telehealth approaches may not be so vast, For example, where I'm coming from, in Malta, when the day centers were closed last year, because now they are opening, but they're minimizing the number of older persons which can attend, so that they're keeping socially, physical distance. When they were closed, they still left open the telephone lines, so that the older persons themselves or the carers, in case of tension, or they were fearing, from something, or even those older people who could not, didn't have anyone to buy them the basics, they ended up without food. They could make use of that telephone line and say what their need was to the people at the other end of the line, in this case, the day centers. Also, but in general, even post-COVID, we need to take into account the digital divide. This pandemic made all the world aware about the importance of technology. On one hand, we would not have survived without technology. Even this conference, for example, we're here together, all thanks because of technology. We can do this because of technology. People from different countries meeting at the same time and discussing these issues. But on the other hand, I'm scared that we might set our mind at rest that if if technology is available for all the older persons, we might put our mind at rest that our older persons are safe. We have to make sure not to let technology replace the human being, not to allow technology to replace the human touch. So while technology should be there to enable older persons to still feel included in society, to enable older persons to get information, to enable older persons to enable them to still live independently in their own community, in their own homes, rather than being admitted to long-term care in nursing homes. If with a little bit of technology, they can still live in their own homes, but still we need to be careful not to allow technology to replace the person, the human touch. So technology should aid and not replace. Post-COVID, I've heard this morning the need for training, to train all the people. Yes, it's important for all the people to be informed, rather than trained, like informed about their challenges, where to get information, and also to be trained on technology, on how to use a simple mobile, for example, because this is the future, post-COVID, and also for tomorrow's older persons. Governments should allocate the necessary financial resources and ensure that the logistics are in place, so to ensure that the rights of all the people are protected. On a United Nations level, for these past 10 years, there had been meetings about the upcoming Convention on the Human Rights of Older Persons. Again, it has never been so crystal clear about this need for a convention on human rights for older persons. Older persons are still human beings, and unfortunately, many of their rights are not being fulfilled. Older persons' needs are taken for granted. Older persons are not seen by society that they are still humans, that they are still persons who can still contribute to society. So it doesn't mean that if someone is 60, 65, or 70, they no longer can contribute, and society is seeing them as a burdens. So yes, it's important that government safeguard the rights and well-being and safety of all the persons, but not only governments, even NGOs, voluntary organizations, and even the family themselves. All these stakeholders, it's important that they should work together. Here I've brought together some best practices of keeping the physical distance, but at the same keeping socially connected. On the pictures over there, we're seeing long-term care facilities in Malta, whereby here we're seeing older persons outside the home, and the relatives can still visit them. So the physical distance is being kept, but at the same, they are still together. Here, we can see the use of technology. For example, this lady she is speaking to her family members by means of Zoom or whatever. And down here, we're seeing this lady talking to a relative, to her daughter, behind the window, and they're talking by means of a mobile. So yes, I mean simple things whereby we can still keep the physical distance, but we are still socially connected. Here I have some examples of what happened in Malta, like groups used to gather, in front of the care homes, and they provided music. This girl on the violin, she used to go around the homes playing her violin while other persons, gathered behind windows and even on the balcony and on the terraces. And what was important as well was that other persons still followed their spiritual rituals, their spiritual routines. And masses were held online so that other persons could still be able to follow their spiritual, their religious routines at a distance online. What happened as well, children, like school children and even through the girl guides, all these children were encouraged to write short letters, poems, and messages to other persons, especially those who were living in the homes. And this is just one example. These are more letters. This happened in the United States. Letters against isolation, which then were sent to older persons. And this was another project which was carried out by the National Archives of Malta, whereby they encouraged older persons living in the homes, living in the community, to keep a diary, to write down their day-to-day activities. So like that, the older persons had a scope every day, writing down or even drawing pictures, how they are feeling, especially when they were in complete lockdown, because the situation here in Malta is that till last year, older nursing homes were in complete lockdown. They had no visits, nothing. Then the measures were being released little by little, whereby visitors used to visit in ways like I've showed you before, behind screens. This is still the situation now. And when there are cases in care homes, older persons are even staying in one whole floor, and they would not be able to leave even their room. So that it's a safety measure, so that they will be careful not to be contaminated with the virus which would be in the home. So this gave a scope to older persons to have something to do during that time. And in fact, we're seeing here Care Malta, which is the largest company, private company who has homes for older people. And in fact, they gathered all these diaries of the residents, and they are presenting this diary to the National Archivist. Conclusions, I think as professionals, it should be our goal to endeavor that older persons age well and not fall through the cracks. In our case, not falling through the cracks of social isolation because of the pandemic. On one hand, yes, it's important to implement these safety measures. It's important to keep this physical distance, but at the same time, we need to think outside the box and think what we can do so that socially we are still connected. At the same time, their resilience must be acknowledged as well. Older persons are a reservoir of knowledge, are the largest reservoir of experiences. They are very resilient. So we need to keep that in mind as well. Let me close by quoting what Antonio Guterres, the Secretary General of the United Nations, said. He said that our response to COVID-19 must respect the rights and dignity of all the people. Thank you. That was my presentation for today.